Why did I choose this topic? I chose this topic about stillbirth because it is something very serious and important that not many people talk about. This could be a very sad and hard thing for families to deal with. I also chose this topic because I wanted to learn more about it so I can understand what some people go through and how they feel. I also think that it is good to talk about these things in a kind and respectful way so we can help others and show them that we care. Learning about stillbirth can help us be more understanding and supportive to those who may have experienced it. Impact on parents. Grief and trauma, risk of depression or PTSD, feeling guilty or emptiness. Some parents may feel guilty even if it wasn't their fault. They may keep asking themselves, what did I do wrong? Or how could I stop this? Things like this can make the pain worse. Some parents may also go through PTSD, which means post-traumatic stress disorder. This can occur after something very scary or sad has happened. Parents with PTSD might have nightmares, feel very upset when they think about what happened, or have trouble sleeping or eating. These feelings are real and very hard to get rid of. I believe that it is important for parents to get the support and talk to someone that they trust, like a doctor, a counselor, or a friend, because healing takes time and it's okay to ask for help. Things like this are not easy to get over, and it's okay to talk to someone about. Marriage says partners relationship. Communication can be broken down, different coping styles, risk of separation and divorce, and stillbirth can put intense pressure on a couple relationship. Both parents may cope differently. One might want to talk about the situation while the other may want to withdraw and not want to talk about it. This can cause misunderstanding, emotional pain, and can lead to communication problems within the relationship. And in some cases, the relationship could be breakups or divorces. Even though both parents are sad, they might show their feelings in different ways. One person might want to talk about it while the other one wants to stay quiet. This can cause confusion or make them feel alone. Sometimes they might argue more or feel like the other person doesn't understand their pain. It can even make them feel more distant towards each other. But another thing it could also do is bring parents closer if they talk and cry and support each other. Sharing their feelings and getting help from a counselor or a family can make a big difference. The impact on extended family and social circle that a stillbirth can leave. It can leave family and friends unsure how to help, can cause isolation or feeling misunderstood, can cause damage and cause the relationship to be strained. Family members and friends may often don't know how to respond to this type of situation, which can leave a grieving parent feel isolated or unsupported and alone. Another thing could be that people may say the wrong thing or say nothing at all, which can unintentionally cause more pain to the parent. Influence on future family planning and parenting decisions. Anxiety about trying again, fear during pregnancy, increased need for emotional support. After having a stillbirth, some parents are scared of becoming pregnant again. Those who do may feel constant anxiety during this pregnancy may think the same thing will occur with this pregnancy. Many need emotional support to cope with the fear of losing another baby. Some parents might feel too sad or afraid to try again because they don't want to go through the same pain again. They may worry that something bad could happen again. Other parents might still want to have more kids, but they may wait until they feel ready. It is very important and hard decision for people to make after going through such a situation like this. One parent may feel different from the other parent. Some parent may want to try again while the other parent may not want to. Some may feel hopeful and others may feel nervous going through this process. But both feelings are okay. But it's most important that parents take their time to heal and talk to people they trust before making such a big decision again. Psychological effect and healing process can be lasting sadness, triggers such as anniversary, due dates, or seeing other babies. Ongoing need for support. The emotional scar of having a stillborn will not fade away quickly. Anniversary due dates or seeing other babies can trigger the grief of a parent. Parents may carry that sense of loss for the rest of their lives, and ongoing mental health support can be essential. Some parents may feel heartbroken for a very long time. They might cry a lot, feeling tired all the time, or not wanting to do things they used to enjoy. This is called depression. Some parents may also have something called PTSD, which means they can keep having scary thoughts and dreams or flashbacks about what happened. These feelings can come back and back again, even after months or years. Some parents feel angry, confused, or like they did something wrong, even when it wasn't their fault. The pain of losing a baby is something many parents carry with them for a very long time. They may feel nervous when thinking about having another baby or worry about that it can happen again. Healing takes time and is different for every person. Talking to family and friends or counseling can help people. Some parents find out special ways to remember the baby, such as planting a tree or keeping memory boxes. Even though the sadness may not fully go away, parents can slowly feel better with love and support from family members and friends. 1. 1 in 160 births equals stillbirth. 21,000 stillbirths per year. Rates higher in marginalized communities. According to the CDC, about 1 in 160 pregnancies in the United States end in stillbirth. This adds up to 21,000 cases each year. These rates are mainly high among minorities, revealing deep health depression. In the United States, stillbirths happen more often than many people think. Each year, about 21,000 babies are stillborn. That means 1 out of 160 births end in stillbirth. That number may sound small, but it's still a lot of babies and families. Stillbirths can happen for many different reasons. Sometimes the baby has health problems, or other times the mom may have health problems, such as high blood pressure or diabetes. In some cases, doctors don't know why it happens. It can happen to anyone, even if the mom is healthy or the baby is healthy, and even if they're doing the right things. Stillbirth is more common in certain groups, like moms who are older, such as over the age of 35, having less access to health care or live in unsafe places. It can also happen in more races, such as Black parents, Latino parents, people who are more likely to have stillbirth than white mothers. Doctors and nurses are working hard to understand more about stillbirth. They try to run tests on multiple people to see what is the causes of this. Birth certificates in the United States, Part 2. It can cause higher risk for women over the age of 35. Common causes can be placental issues, birth defects, social determinant of health matters. Stillbirth risks increase with maternal age, especially for women who are over the age of 35. Medical causes include issues with the placenta, infections, or birth defects, but border factors like access to healthcare, stress, or income can play a huge role. Stillbirth can sometimes happen because there is a problem with the placenta, which is the part of the body that gives the baby food, oxygen, and nourishment during the pregnancy. If the placenta doesn't work the right way, the baby might get enough to grow strong. The placenta can get damaged, stop working too soon, or some can come apart from the womb, which can be very dangerous. Not having access to health care makes pregnancy much harder and can raise the risk of stillbirth. If a mother cannot see a doctor often, she may not know something is wrong. She might miss important tests or treatments that can help her and the baby stay healthy. Having a low income can help make it worse because some families cannot afford doctor visits, good food, or even a safe place to live. They may also feel a lot of stress, which can affect the mother's body. All of these things can make pregnancy less safe. This is why it's important that mothers get the care and help they need when having a baby. The first one is March of Dimes. It helps moms and babies stay healthy. They give support for families who has lost a baby and teach people how to prevent stillbirths. The second one is Share pregnancy and infant loss support. This group gives help to families who lost a baby during pregnancy or after birth. They have support groups, memory events, and counselors to talk to. The third one is First Candle. It helps parents who have lost a baby from stillbirth or SIDS, sudden infant death syndrome. They offer a 24-hour grief line and support for families. The fourth one is Star Legacy Foundation. This group teaches people about stillbirth and helps with research. They also offer free support groups and counseling for grieving families. The fifth one is Miss Foundation. It offers support to families who lost a child at any age. They have counselor support groups and online help. This last one is Now I Lay My Head Down to Sleep. It takes free and gentle photographs of babies who have passed away to help families remember them in the long